So there's a lot of people that say, Dr. Reed, does fibromyalgia actually exist? Hey, my doctor says it doesn't. He says, it's not a real thing. Maybe it's just all in your head. Well, guess what? Part of it is actually in our heads. Hi, this is Dr. James Reed, chiropractic physician and certified functional medicine practitioner. So I get, asked the question, hey, Dr. Reed, does fibromyalgia really exist? That's a great question. I know a lot of physicians will argue it doesn't really exist. Things are it's just in your head. Well, guess what? Part of it is actually in our heads, okay? With fibromyalgia, they've done functional MRIs and they have actually found, changes in neurological activity in the brain of people who do have fibromyalgia. There's actually signs of inflammatory changes. They've actually, found changes in neurotransmitter activity. So in part, yes, some things are real. But the problem is that it's multifaceted. There are many different triggers, and not everybody has the same clinical presentation. So in other words, they may have different levels of, problems with sleep, with fatigue, with, muscle joint pain, muscle stiffness, changes in actually the gastrointestinal tract. So they all seem to be dissociated types of different symptoms. But actually, there can be several things that are actually going on contributing to the dysfunction of the nervous system, dysfunction of your muscles, tendons, ligaments, your fascia, that can contribute to all this. And even your immune system, okay? Of course, some of the newer research seems to be pointing out that there's quite a bit of immune system imbalances, and that can, go back and fold back into problems with the gut. Again, you've got 70 to 80% of your immune system in your gut. So there's this, this imbalance that can take place here in your gut, and your immune system affect the brain. Of course, we talk about the gut-brain, axis. And, keep in mind too that there, just as a small example, you can have mitochondrial dysfunction. And that can be a contributing cause to some people's problems with nerve function and muscle function because, both those tissues have a high amount of mitochondria. And if you're not, if the mitochondria are not functioning correctly and not producing the proper energy, those tissues are not going to function correctly. And ultimately, you might have fibromyalgia symptoms, so you can get lumped into that category. So like I said, there are a multitude of different things that can happen. Maybe you're not absorbing your nutrients correctly, and there are many different minerals and vitamins and antioxidants that are important to keep down inflammation. They can affect your immune system. And of course, again, your immune system kind of drives a lot of the inflammatory changes throughout the body. And again, I think bottom line here is it's inflammation, of some of the different tissues, and it results in some of the dysfunction of the muscles, tendons, ligaments, fascia, the nerves, of course, and this is what makes it very confusing. So it is really difficult, in all honesty, for most physicians to say, hey, you have fibromyalgia. It's like, well, it's the garbage, pail type of diagnosis, is that they don't really know exactly what it is, because you've got anxiety, depression, chronic fatigue, muscle pain, this and that. And, there's not one single pill, not one single reason why you have these issues. That's why we try to address some of these different things here at our office. We try to take a look at some of the different components that may be contributing to the inflammation and dysfunction, like I said, of your nervous system, your musculoskeletal system as well too, even the vascular system and immune system. So all these things have to function correctly, and when they don't, and you have the resultant inflammation, it's going to cause dysfunction of all these different tissues. So that's an enormous task, okay, to go ahead and track down and figure out. So, yes, I can see why there's quite a bit of confusion and, why, hey, that entity of fibromyalgia, yeah, okay, maybe you have it, all right? We don't know what else or how else to explain it because you don't have a specific disease process going on. And again, it's, how do you measure it? It's not all that easy to go ahead and measure some of these different things as well, too. So, does fibromyalgia actually exist? Yes, okay. And certainly people who do have these symptoms will definitely say, oh, absolutely, this is just not all in my head. So yes, like I said, some of it's in the head, but it's also in the body too. And there are actually some real physiological things going on. And, the research is coming out more and more, trying to point out, looking at all these different triggers, and they realize, yeah, there are different triggers and things that do, cause some of these different types of symptoms that all seem to be collected together. So I hope this short little video is helpful for you, and hope we can direct you in the right direction if you're looking to go ahead and seek some relief if you are suffering from some of these different problems. So I want to thank you very much for watching. Of course, my name is Dr. James Reed. I am a chiropractic physician and also a certified functional medicine practitioner. If you're having problems with fibromyalgia and you're interested in finding out more information, I would encourage you to go ahead to my website at AZ Family Health Center, CENTER. For more information, we have a lot of videos and other articles that address some of the different related topics to fibromyalgia. Of course, I would encourage you to also contact my office at 480-732-0911, and one of my staff members would be happy to go ahead and assist you in setting up a one-to-one personal appointment with me and see what we can do to try to help you out. Thanks for watching.